go ahead and get going on the sort of range of discussions that we're going to look at today. Um, Today's meeting is building, I'm sorry, go ahead. Did somebody say something? No? Oh, okay, somebody must have just muted. Thank you. Today we are going to build on some of the key or all of the key takeaways that we got from the discussion with the BHAC at their meeting that happened on Tuesday. And our goal is to ensure clarity around the BHC's role, the governance, and the collaborative priorities that we have so we can move forward effectively and in alignment with BHAC. So I want to start by framing this discussion with some simple, but I think it's an important shift in perspective, which is instead of asking at this table or at the BHAC, why would we work together? And that's whether it's between tables or it's within this table as different agencies. Why would we come together? And instead asking, what can we create together that no organization can achieve in isolation? And so I'd like that to be the question that guides our conversation today. And with that in mind, our meeting objectives, as you will see on the first page of the meeting guide, and I'm putting the link here. The only difference in this link and what you have that I sent you earlier is that each conversational topic is numbered. I thought that might make it easier for folks to follow. So our objectives are to build upon, of course, that BHAC discussion, reinforcing collaboration while addressing the key concerns, to clarify the BHC's structure, governance, and legal role, particularly in response to some questions that came up at the BHAC, to strengthen internal alignment, ensuring that members here at the BHC table feel clear, confident, and understand how and why they're committed to the collective priorities that we've set, and to reaffirm and refine the collaborative potential of what we as BHC members might be able to do, even identifying some opportunities for impact. So with that in mind, let's go ahead and start with the key takeaways that we got from the BHAC discussion earlier this week. And I'm keeping close track of my time here so that we move through. I'm going to stop for a minute. If you go to it's section number 2, the key themes from the BHAC discussion. I'm going to give you a chance to look at what's there, both at what they recognized as valuable and what some of the key changes were. So I'll give you a minute to just have a look at that starting on page 2. I'm sorry, page 1. So I'm going to start with what the BHAC discussion revealed that folks thought was valuable. And before we move on to concerns, when you read these points, is there anything that stands out to you? Do these affirmations align with how you see the BHC's role? Is there any feedback you'd like to give to what you see there?
This is Jim. I think it captures what we believe the BHC to be and has been for a number of years and what its founding principles were based on. I think it does a good job of encapsulating that personally.
Okay, that's great because all of these conversations, both what happened at the table and what happens here today at the BHC table and what happens today, this is going to be a lot of the substance of what we want to get into this MOU that we're writing between the two tables. So appreciate that feedback. Anybody else before we move on to the concerns?
I'll echo that. And just to say that I think it clarified for some folks who may not be familiar with some of the distinctions and the institutional knowledge that a lot of folks sitting here have about the purpose, function, um, history, and the value that I think BHC brings to the community. So I was grateful to hear all of that.
It was. It was good to hear it. I'm so glad folks came to that discussion. And to Apple and the whole table for inviting us to that. It's a wonderful chance for the BHC and the BHAC to chat together. Okay, so there was a lot of positive recognition, and there were also some concerns raised that I think we need to address, and I wanted to bring those to this table. Uh, the You've looked at the key questions and concerns from the BHAC around, is it a legal entity? Who controls the funding? What authority does the BHC have to receive or manage funds? And there was one public comment from the meeting that basically it was conveyed that now that the BHC is not actually a legal entity or affiliated with any organization, they're wondering what authority the table has to receive or allocate funds moving forward and what transparency measures are in place to ensure accountability for those funds. And so I've put in the meeting packet a response to that. The first is that we do not directly receive or distribute funds. Funds are held by fiscal agents like DBH that's holding the funding that essentially pays for me to come and hold this table for you folks. These folks, whether it's, Jefferson Healthcare because they anchored a grant that a few of us went after together, or it's public health, all of these various agencies are acting as financial stewards, but they're not making the funding decisions. The funding decisions are made collectively by the BHC members, which is why we've done so much work around what does our governance look like, what is our voting model, and then the governance structure, of course, is there to ensure that we have accountability, that funding priorities are set through a collaborative decision-making process, and all fund use is subject to reporting and oversight. So I want to give a minute for folks to absorb that and then ask what other questions or concerns do you think should be addressed? And have we addressed these well? And how can we get the word out there? I'll be quiet for a minute and let you think about that.
Lori, I think it might be helpful to me, especially wrapping my mind around all this newly, and I was grateful to be able to sit at the BHAC table as well. And I think maybe important to point out to everyone that county commissioners decided at the beginning of this year when we were redistributing the committees, the whatever 25 to 28 boards and committees that each commissioner sits on, that we would kind of try an experiment of putting like committees more together than they have been in the past, under the responsibility of one commissioner who then kind of can focus in a particular area. Whereas before we had a commissioner sitting on the BHC and a separate commissioner sitting on the BHAC. This year we're putting both of those on my plate as a single commissioner. And just in these first meetings that I've attended, I can see the value in that and kind of being one of the several connection points between the two. But my question around this is, I wonder if there's value in getting a little more specific in the BHC's response around this very last bullet, Lori, which is the governance structure ensures accountability. Funding priorities are set through collaborative decision making, and all fund use is subject to reporting and oversight. It might be useful to get clearer in that response about who's doing that reporting and oversight, and it may be a little different depending upon which funding source we may be talking about at any given time. But right now, my understanding is that reporting and oversight is done by Discovery Behavioral Health Care. Is that correct?
So
That is correct.
Go ahead.
Okay.
So
Great.
Lori sends her invoices to us, and my CFO produces the report and how much money. We are in the process now of actually putting that all together and sending it to the county. That shows what all the expenses were for, with all the backup, and what those total expenses were. I've been working with Judy Shepard. We work with Judy Shepard on that, who's the finance person for the county. So she gets all that reporting, and these are the monies that were allocated to us out of the distributor fund of the opioid dollars, which I guess has been some mass confusion over all the opioid dollars that are coming in.
Various streams.
Whether it's,
Yeah.
but anyhow, so these were county funds that were delegated to this table by the commissioners at a meeting that I sat at, and was distributed not equally. This is the funds that were given to the BHC for that table. So when people question about legal authority, I would say the commissioners are the one that made the decision that the BHC would be able to use this money to afford to have Lori, who does an excellent job, obviously, of pulling this together and keep this table going forward. So yes, and my CFO prepares these reports on a monthly basis. Make sure everything, we report this information to actually our board of directors also, that sees how we spend that money and where that money goes to and how it is broken down. So, and I want to just say something. We do this with no administrative overhead whatsoever. We do this
I noticed
for free.
that.
Yes. So, that's what's important to me, because I felt like, as the behavioral health agency for this community, that's part of my mission, part of our values to do this, because I see this table, as people have known and heard me in the past, as being extremely important to behavioral health in this community. So
Thank you,
I don't know
Jim.
if I didn't hope to answer your question, but
It does, absolutely.
Okay.
And if there's anywhere that this, these notes or this document ends up going, I think it's valuable to just put that, a little bit of specifics there around the reporting and oversight, because it's a really important question that was
Important
asked.
question and very doable. Thank you. Apple?
I don't have the answer to this. I'm sort of just posing it because my brain is sort of just wondering on behalf of us all. With the question about legal entity, and thanks, Jim, for explaining that. I think I did know those things, but it's nice just to have that out for all of us to hear. And the commitment you've made to helping keep the table alive with those funds as prescribed by the commissioners. The idea of a legal entity, it's confusing to me. I'm not an attorney, although I do have questions to our local PAO here at the county. I haven't heard back from him yet, but it seems to me that even though the BHC is not its own nonprofit, that the fiscal oversight, I don't know, is it not enough to be recognized as a legal entity, given that the commissioners dedicated funds specifically to the table? I'm just lacking in my understanding of how these entities get defined and how do we track that their definition, we're abiding by it. I'm thinking about things that that are in the community that kind of exist similarly. Are they considered legal entities too? What about the ICG? Is there anybody on here who's part of that, who understands how that collaboration exists as an entity and how it's noted officially? Is it a legal entity or is it a collaboration of folks? I don't know.
It's a collaboration of folks, and it doesn't have the same issue because it's not distributing funds. That's when it gets tricky, right? And that's when you need the legal entity, which Discovery Behavioral. Can I just set the record straight? Is it Discovery Behavioral Health or Discovery Behavioral Healthcare?
Healthcare.
Thank you. That's
Thank
what I
you very
thought.
much for
That's what I
asking that
thought.
question. There is a Discovery Behavioral Health that actually is nationwide, and it
Thank
just
you.
gets very confusing sometimes.
All
Yes.
right. I've looked it up and I thought I was I just wanted to say it right.
Yes.
Thank you. Anyway, that's why it's important for Discovery Behavioral Healthcare to be the entity that receives the funds and then uses the BHC as the decision body, almost like a board. But I think it's really worth running this question, which I think you've already submitted to Philip or James, and just to kind of get that really get that legal opinion, because we are not attorneys.
I mean, as you just described it, it seems to me that with DBH as the fiscal oversight, it is in essence nested inside a legal entity. So therefore, it is also a legal entity. But I don't know. So that's the question I posed to Philip Hunsucker. And
So, and one thing to remember is the money that comes through us is all 100% to support Lori and her work. So we don't use that money and distribute it for anything else. So the only money that would get distributed is by the BHC, is any other grant money that is brought in and then would be distributed by the members of this group would vote and make those decisions. So
yeah, so then the question is, does Discovery Behavioral Healthcare have to be the applicant, for example, on those grants, or can the BHC be the applicant? And so we should just clarify that.
I think it could be anybody at this table. So the last time we went for a grant, we used Jefferson Healthcare as the grantee. It could be us. It could be anybody else that has the ability to go for federal grants. And we are authorized. We're part of SAMHSA, and we can go for those grants if we want. Grants.gov. I mean, you got to be registered and all. And we are registered as an entity, and so I believe Jefferson Healthcare and maybe some other agencies here that can go for those dollars also.
But the beauty of the BHC is that we have this skill of shepherding a lead agency, say, for instance, who wants to go for a grant, do the thing, get ready, prepare, and it's all sort of supported and vetted through this table, which is a collaborative consortium effort, which I think it's unique. And I appreciate that there's that different modality, at least in between, the BHC and BHAC. I mean, I think it's really good we're working on clarifying these differences, but also synergies.
You're also reminding me, Apple, Lori, you had mentioned that, this is not a unique, although of course the way the BHC is created and sort of comports itself is uniquely Jefferson County, but that BHCs are made all over the country, correct?
Yes.
So, we can also look to them to see, to answer some of these questions and use whatever model we need to use to make sure we cross all the T's.
Okay, so what I'm taking from this is that we're going to more fully articulate what that accountability looks like and figure out ways to get it out there, not the least of which will be on an FAQ that's available on the website. But there are different tables we can go to and make sure that that is trumpeted clearly. And then also, we've got this question of the legal entity and what other agencies are doing, what our own lawyers think we should be doing. So it's something that we're running down. Are there any other questions on that before we go on to the next topic?
So my real question about this last week or earlier this week, whenever that was, came from when I asked this question originally in December about it going through DBH to the BHC. I was told that the BHC is not part of DBH. And so this is why I re-asked the question, because then I asked again when you and I met one-on-one during your open hours for whatever meeting that was, and was told again that it was not part of DBH. And so these are my questions. Like, originally the BHC was formed under public health and the HRSA grant that public health had. And so the BHC was able to disperse funds related to the BHC and the HRSA grant and whatever else. And so my original question came from that after reviewing you showed us very briefly a spreadsheet of where this money is going towards every month. And
which, by the way, is on the website every month.
Right. And I have more questions about that. And I mean, this quarterly meeting is costing the county $6,000 a month, plus additional fees for AI use and whatever other expenses you have on there. But we're only meeting quarterly with a very occasional meeting in between. And I just think that the opioid settlement funds are very clearly laid out in legislative for what it is supposed to be going towards. And I do see value in this table, but I don't think that is what the opioid settlement funds are intended for. And I don't think spending $72,000 a year on this meeting rather than investing in direct services is an appropriate use of the funds.
Thanks, Gabby.
And I have more questions about it, like where is the transparency and accountability as this money is, when it's under public health, everything's public record. When it's under this, it's not.
Apple?
Seems like it would be helpful to look back at, I think, the 14th abatement strategy and the One Washington MOU, and it speaks specifically to leadership and administration, which doesn't, Gabby, doesn't resonate with me. Like, that doesn't sound like direct service to people in need. I get that the optics of that are kind of off, but I think it's also worth remembering that as the BHC kind of launched away from public health and finished, like, graduated from its HRSA.
Apple, we're having trouble hearing you.
Really? Sorry. Can you better now?
Yeah. Try
Okay.
again.
If you missed it, I was wanting to reference the I think it's the 14th abatement strategy of the MOU from the state for the opioid settlement funds. That was the one that felt like it really fit with the BHC's sort of drive and mission and its uniqueness in this community. It's always good to refer back to that. I feel like funds are in the alignment relative to the intended purpose. But I was also saying that, administration and leadership, which is the piece.
I'm sorry, Apple. We can't hear you well. I'm so sorry.
Sorry.
I think some of what she might have been saying is that on the Washington MOU, there is a category called planning coordination. What the third thing is, and that is when the BOCC allocated these funds, that is the primary thing that they were looking for from the BHC, that there be planning coordination across the county and the various agencies. And it was something that is directly called out in the list of services on the Washington MOU. And I don't want to speak for Apple, but I think that's what she was trying to say.
Yep, and that's line, actually the spreadsheet that was given to us by the county to report on, it's line 13 on this spreadsheet, and it's J1 to J4. It's called Leadership Planning and Coordination, and that is an authorized use of the opioid dollars.
So I do hear Gabby's concern, though, that this meeting is too expensive, that what you're getting in return for the funding is not, of commensurate value. And I'd like to give people a chance to weigh in on that. I think it's an important topic.
While people are thinking, it's not something I can weigh in on directly or feel very comfortable weighing in on right now, just being so new. But I do have a question that you may or may not know the answer to, Lori. Do you know is there consistency across BHCs and other places in terms of where they typically receive their funding?
No, I don't. I think
There's
it's very different across yeah.
They're all funded in various different ways.
Mm-hmm. And the idea of keeping this table together, I can promise you that a lot more work than $6,000 worth goes into everything that gets done at this table. It's more than just one meeting. It's the 15 meetings that happen behind the one meeting and the documentation. But I think if it's done well, it's probably not seen, so I really want to give people a chance to give their feedback on that. I think the other thing to note is that you won't be paying that much money going forward because we don't get that much money. the idea was that we be able to keep the table going so that we can go out and get other funding. And there might be reasons why this table is valuable beyond that. But what I'd like to do is we've got some discussion. We know that there are some questions there. And I think one of the big ones is, are you getting bang for the buck? And that's something I can't answer for you, but you guys have to answer for yourselves. So what I'd like to do is clarify how the BHC and the BHAC differ in their roles and responsibilities. So if you go on to your next, let's see, we're on page 3 of your packets. I'm going to give you, be quiet for just a minute, give you folks a chance to look at what we've put there that's been updated even since the BHAC meeting. So I guess for the sake of discussion, I'd like to ask, what aspects of this comparison do you think need to be better communicated to stakeholders? And are there areas where we as BHC members need to be clearer in how we talk about our role as you look at what we've got in these comparisons?
I guess if there's misunderstanding about this just being one meeting quarterly, like I see this meeting and Lori is like a golden thread through all of our different agencies and service organizations, and a space for us to have, like what you say here, information about data across the county and opportunities for collaboration, that if this money were just to go to one organization, to pay for like one employee, we wouldn't all be here collaborating and knowing what each other's doing. I probably wouldn't know all of you, and we wouldn't, be having collaborative events and building relationships with each other. So I think of value isn't just that we meet quarterly, but it's everything that happens in between those quarterly meetings for us to, hopefully be getting on the same page. And also another really strong value is like applying for other grants that could potentially fund more work in the future, like funding the CARES program and Recovery Cafe and different contractors and a lot of other programs that I'm not thinking about right now.
Thanks, Anya. Anybody else?
I think I might add to that too, and just say, I don't know how to provide, I would say, quality, engaged, thoughtful, strategic services without talking about it before we provide them, whether that's with my own staff in our program here or with other organizations and entities at this table here. So I do understand, we have limited time and you don't always want to be in meetings, and there's a lot of the same people in each room. But when the 1% grant funds are limited, such as they are, and we have greater needs to address in our community, this is where we discuss that. What are those gaps? Where do we get the money to provide those services? And then amongst us together, how do we do that exactly? We do want this money to be benefiting, of course, people directly at the end of the day. But we could also, if we don't have these discussions, whether that's one-on-one or in these sessions here, I don't know how we do that in a way that is an effective and responsible use of the funds.
So Brian, I want to follow up with that a little bit, which is a great, the way you put it is really wonderful. Let me give a little scenario that we're maybe facing. We have a state that has a tremendous budget shortfall right now. We have the federal government that is looking at cutting Medicaid, potentially chopping it to pieces. And when that happens, the services we're providing in this county are going to be potentially affected. We do know there's going to be some potential roll on grant dollars. They've already tried to freeze NIH grants, all sorts of other federal grants. And when we have agencies that live off those grants, It could affect them and their ability to provide those services. And let's focus it down to even opioid services. So when some of that, if that potentially happens to where agencies' dollars are cut, Medicaid dollars are cut, this table could become very important as us coming together to figure out how to collaborate and keep those services going somewhere, and kind of figure out how we can make sure that there are no services at all. And I've been through this before in 2008 when I was in the state of Illinois, when there was the Great Recession and there was no non-Medicaid dollars coming out of the state. At that time, I was the regional director for the southern part of the state, and I had to work with 36 different agencies and keep them afloat somehow. We had agencies that were on the verge of closing their doors and not being able to provide services. And what we did as region directors, it was 5 of us. We had a weekly chat, and we were able to get together and figure out how agencies can help each other, collaborate, and keep services in those counties viable. And I'm not trying to do gloom and doom here, but we are really looking at potential cuts that are coming. And I can see a use for this table as all of us collaborating together to come together and say, wow, how can we all make sure that, that this service is no longer available because that grant was pulled? And those things could potentially happen. I think that's why a table like this is important.
I don't know if everybody saw Apple's comment in the chat.
Huh.
I'll just read it. I'm not sure what it is that just changed on my microphone. The commissioners agreed at the BOCC workshop that using the opioid distribution funds would get the BHC table to persist beyond the end of the HRSA grant, and many hours have been spent between last August and now to equitably source the ways in which the BHC should and can be governed. That work had to be done to create the survivability of the table, and it doesn't happen overnight. And the BHC going out for larger grants now and in the future can only happen if the table is securely staffed and promoted so that its members are engaged.
Thanks, Viola.
And that's where I'm confused because how is the BHC going out for larger grants when it is not an entity in itself? It would have to be an organization going after a grant, not the BHC.
But I think what people are trying to communicate is that they see use and the group supporting one another in getting grants for different organizations or needs or people that can better take on or better seated. Now, I am new to this group. I've been part of a BHAC before in Clallam County. And they were, even though there was a lot of discussion around the table with many organizations like we are right now, it really only managed one fund. And from what I'm able to gather so far, this is where the BHC is flexible and can support the community in many creative ways, regardless of who holds the funds.
Anyone else? Okay. Let's move this discussion on then onto the governance structure and how we make decisions, since that's an important component of if we've got any one agency holding a grant, how do they get distributed? And I think this distinction of the BHC distributing funds versus the, who holds the actual grant, I think that this is where we address this in how we do our governance. So on the governance structure, which is at the top of page 4 of your meeting packets, I wanted to get some clarity about how the BHC is working toward making its decisions. Now, this whole governance process is something that we are in the throes of trying to get agreed upon and ratified and put down on paper. But where we are at right now is what you see there at the top of page 4. So I'm going to give you a chance to have a look at that and then prompt some discussion. So does what's outlined there between the governance model using a, what do they call it? A fist to five voting process. That was Greg Brotherton's contribution. And the fact that we are going to be, run as a sector-based voting model, which is something we've all discussed. Does that input, knowing that these decisions are made as a group, no matter who holds the grant, does that address the concern, Gabby, that you're bringing up?
Not really.
What would you need more that would help address that for you?
I mean, having more transparency, having more oversight overall to what's going on, how the money is actually being allocated. Like I haven't seen any other than your spreadsheet that you've sent out or shown us. I haven't seen anything from anywhere else about the oversight of that. Getting grants moving forward, it wouldn't be the BHC applying for a grant. It would be one or more entity, like public health applying for a grant, or the hospital applying for a grant, or the court would have to, or me or Jim, somebody would have to apply for that grant. And typically those grants that we're looking at are for a specific program. It's not just for like, hey, we're going to give some people money that sit at this table. How are we going to do that? Where the BHC originally had the flexibility with those funds for certain things. Moving forward, going after some of these grants, they want what you're doing with the money beforehand.
That's why we develop our, the project plan that we would submit in a funding application. That's why it gets developed here at this table, so that the decisions first, whether we're going to go after a grant or not. And then as we begin to coalesce what our thought is amongst, multi-agency stakeholders, what it is that we could actually do with that money, then before the grant gets submitted, it has to be approved, that application is what this group wants to put forward. So it seems like the who gets the money is always decided at the table, whether it's money that we've got or it's money that we're going after.
So, I mean, anytime any of us are going after grants, I mean, a lot of our programs are grant funded. It's that most of our organizations are grant funded. So are we supposed to come to this table and say, here's this grant we're going to apply for and let's vote on it? Or like, I mean,
I don't see anything in here that precludes any organization from going after a grant it wants to go after. Does it?
No.
No,
Not to my mind.
Okay, so if you want to go after a grant, go after the grant.
I think
This is the collaboration and bringing everyone into it.
And there are grants out there that really require partnership sometimes. So we may go for a grant with it includes multiple members of this group being part of that and getting parts and pieces of it, because it may involve housing. It may involve, the services within that housing. And those are the kinds of things that you have to look at, that there are different grants that hold, in fact, the biggest grant out there that's going to come into this town eventually, hopefully, will be a CCBHC grant. And that's a grant that really requires sometimes a partnership with other people to provide like medical care and medical services. So, and that's what this is. It's just a collaboration that would bring these people together, say, would you like to be part of this services in this grant? So, and yes, there's individual grants that I can go for. I don't have to have the BHC involved. And just like Peggy said, I mean, go forth and go for it. I mean, that's, it's not like you have to have the approval of the BHC to go for a grant.
Anyone else?
I might just add a little perspective, and as I try to understand what's trying to be accomplished here. And I will say that I really had wished and was trying to accomplish a table like this in the housing world. And the value that I could really see to that was really needed a foundation of trust amongst the organizations to be able to come to the table. And it does take time to develop that because it really does require a level of risk on the part of each organization to share what we have otherwise perceived to be really proprietary information in a very competitive and perceived to be competitive environment, right? I mean, that's the way it is in housing. And I would imagine it's very similar in behavioral health, where we are, by the very nature of the funding sources, pitted against one another to provide services often to the very same people. And so, Gabby, if it's at all helpful to think about what maybe is making you feel uncomfortable, what information you would or would not feel comfortable sharing at this table, that may be kind of the crux of what's creating this, the questions, which are, from my very outside perspective, are very good questions. And I think exactly the questions that need to be asked when you create an endeavor like this. But the value of being able to say, I mean, I very much, in fact, Viola and Peggy may remember when I transitioned from being the development director at Bayside to overseeing housing, or sorry, overseeing operations. I started to kind of reach out to other organizations and say, hey, I'm gonna, I'm gonna recommend that we go for X grant. Is anybody else going for this grant? And there was crickets until and then I started to realize, oh, actually, this is not information that we're used to sharing with one another. And there are good reasons why we didn't, because of that competitive nature and maybe a level of distrust. So I'll just stop there to say that, just what I'm observing is a really useful beginning of something that is very likely to maybe require some time for each entity to feel comfortable really coming to the table and saying, yeah, I trust this process. I trust it enough to tell this whole group, hey, I'm thinking about going for X grant. Is anybody else going to go for it? Should we strategize together about which one of us should go for it? And or are there large funding sources that we should go for together? And if we could get to that point where we're comfortable sharing that level of information and strategizing together as a whole system, that could add a lot of value, but it may take a little bit to get there.
I would love to add to that really quickly. I'm currently at the table with two different organizations, one in Clallam, one in Jefferson, assisting as they apply for grants, like actively helping them write up MOUs, develop policy, share information. Like in the entity in Jefferson County, we're talking about sharing office space with them so they could be more centrally located. I think that's the value of this group. One of these days, I'm going to come here and I'm going to say, listen, I think I might have a bead on a grant that we can open a medical respite. Who's with me? And I think that's where we all have value, because there's no way alone we're going to be able to tackle this. And so much can be lost if we're all just going after our own grants all the time, because that's how we have gaps. This way we can make sure that we don't have gaps in our community.
I think one advantage of this table also is that if you're going to write a grant between several organizations, it's usually a pretty big process to galvanize even who's going to be on it, what we're going to do, and then to say that articulately in a way that everybody agrees with how it's said. It's a major undertaking. And I think if you've got a group at a table and a trusted resource who can help you pull that together, that's a leg up that a lot of communities don't have and might allow us to put together, an application that shows thoughtfulness about how we would steward whatever funds we get, and and a real opportunity to do something with those dollars in a thoughtful way, rather than the way which I have done many grant applications for, which was very slapdash. We put it together and then we got the funding and then we tried to figure out how to do it. And that is, you know, ideally we would be doing something that is far more thoughtful than that. And I think where we are at this table and the resources that we've got and the value that I bring to it, I think that's something that we can do here. Okay, any other thoughts on that before we move on to the next topic? All right. Let's turn then to what we've learned from our last funding pursuits and how we can apply what we learned there going forward. If you look at the past grant applications, even if we didn't secure funding, or we just spent a good bit of time considering, do we want to go after this funding? I think that we have strengthened our ability to act as a united front for future opportunities. We've identified priorities, we've identified challenges about going after a grant to do a specific thing that we didn't really have time to do until the prospect of going after a grant application forced us to have those conversations. So even when we don't secure funding, there are some things that we've learned. I would say we've had a few different times to do that. One was with the RHNDPP application, and I've included a link in your packet to what that grant looked like. It was for a multi-agency collaboration to improve patient care and coordination, and that was a collaboration between DBH, Jefferson County Public Health, Jefferson Healthcare, and the EMS council, singular. In this last opportunity where we looked at the Healthcare Services Outreach Program grant from HRSA, and I really appreciated the engagement from everybody as we really thoughtfully considered whether that was an opportunity we had the wherewithal to go after. We had the idea of what we would want to do. I think that one of the key things that came out of that was this idea that this integrated behavioral health and primary care is a critical gap that BHC members would really are very interested in addressing. While we couldn't do it in the time frame that particular grant outlined, I think just the awareness that is a top priority amongst the people. It could be I think it was Brian Richardson who said that could be a real game changer, even if it was a small amount of that sort of service. Obviously, youth mental health and early intervention, it's a high priority for this community across the board. And of course, sustaining our substance use and harm reduction programs, both the systems of harm reduction as well as the actual programs like Recovery Cafe and the Nest, etc. Some of the challenges that we identified for ourselves is readiness and capacity concerns. Not all agencies are prepared to provide or accommodate the scope of a HRSA grant because they're usually huge. It has a lot of not just requirements in terms of what they want you to do in return for that money, but the reporting on it can be pretty substantive. And then there was one of the things that brought out that I hadn't really heard before was this caution about relying on some of the early stage regional programs like Olympic Connect, because in this current landscape of uncertain funding and the early stage of development that it's at, there was this question of how, we'd like to see it put together longer and know more about its long-term funding before some of our groups, some of our members put a lot into being a part of that regional system. So those were items that folks came up with. Are there any others or any comment on the ones that I've noted here?
I'll make a comment, which is just to reiterate my views on the integrated behavioral and primary care is, I appreciate hearing what people have to say about, at the end of the day, I think we have the same goals for our community here. We want the most marginalized and vulnerable people in our community who are experiencing behavioral health issues to get access to the care that they need. some of which is through the programs that we currently run or maybe are expanding. And some are things that we don't have in our community yet. We have unique challenges in a rural area like ours. I think integrated behavioral and primary care might be the single biggest thing that we could step toward. And while I can identify, later in this list, that maybe Recovery Cafe will get a little bit of funds if we focus on one of these other ones. I trust that we can communicate the value of what we're offering here in other places. We can pursue grant funding, we can ask donors for money. But if I'm thinking of like the greatest collective impact that will benefit people who are accessing Recovery Cafe, let alone those who we are not serving, but are currently very much underserved in our community, that would be my strong vote on that. I know we're not making that decision in this moment, but I just wanted to make that really plain.
It's a spotlight one that we'd really like to find some funding for.
Mm-hmm.
Other thoughts? And I do want to say I see, and I'm sorry, Anya, I don't know if you put that in there a little bit ago. I think we all have shared goals, meeting the needs of people impacted by opioid use, and we can use this table to strategize how to support each other to meet shared goals and better serve the population these grants are intended to serve. Thanks, Anya. Okay. So I'm going to go forward then. Let's now discuss what we can achieve together that we couldn't accomplish alone. And it sounds like one of those things might be what Brian was just talking about. So we've clarified the key themes from the BHAC, and we've reinforced the distinctions between the two tables. And so now we're going to shift into what we can create together. And I think that this discussion matters because the BHC exists so that individual agencies, no matter how strong, or with the awareness that individual agencies, no matter how strong they are, they can't tackle county-wide behavioral health challenges in isolation. So the power of this table comes from what we build collectively. So when we look at going forward, knowing that the BHC brings together these agencies, funding streams, and strategic initiatives in a way that maximize impact, what funding or strategic opportunities do you see that we should pursue next? And beyond funding, what system-wide changes should we work toward together? And that's part of what Brian has just talked about, but does anything else come to mind?
Lori, I don't know.
I was just going to say, I'm waiting for somebody to bring up housing. Go ahead.
Well, no, actually, I was going to bring up dementia. Our older population, and Jim and I have had this conversation. There doesn't appear to be any resources for that. And I don't know if that's part of behavior, in the definition or not. So I just want to throw it out there. Dementia and traumatic brain injury.
Thank you. Well, it's definitely behavioral health, and I can see how the funding that we're under right now, the opioid settlement funds, has a very specific focus on substance use disorder and mental health disorder. And I'm not saying that you couldn't get a grant that addressed some of that and also addressed these other things. I think it would be a strategic sort of braiding that we did, but with the priority being on being able to show that by pursuing that grant, we are addressing these funds. I mean, you might make the case that like with the CARES program, it's not all behavioral health. A lot of that is elderly folks who are, in need of a lot more of our EMS services. And any of the ways that we can work to ensure that we're not calling 911 all of the time, that we've got these other measures in place, I think are valuable. So I think that that's an example of where we have funded something that is both behavioral health and in elder care, elder focus, maybe not just dementia, but certainly making sure the rugs aren't where people are going to be slipping on them and falling and breaking hips and that sort of thing. Anyone else? Ideas around what sort of strategic opportunities we might pursue or how we could use this table to create solutions that don't exist? Apple?
I'm going to test my microphone. Is it working?
So much better.
I've never had a headset, so bear with me. I know that Dunya is not a part of this group anymore, but I've had many discussions with her in the past about maternal child health and especially neonatal abstinence syndrome, or NAS, which is um, babies that are in utero exposed to opioids and other drugs and then born um, and need, highly trained, very selective care in order to transition out of the womb and into this world with us. Um, I don't know where that discussion has landed ultimately, and I haven't talked to Jake about it at all with regard to care at the hospital or the number of transfers that happen to other NICUs in the region, well, not our region actually, but across the water, probably to Mary Bridge. I do think that in all of the behavioral health tables that I attend, there's very little emphasis on maternal child health, and it's not anybody's fault. It's just I feel compelled to talk about it some more. And while in public health, we are not working in critical medical situations with our clientele, we have proximity to that by offering home visiting services to pregnant and birthing people, and then trying to work from prevention and behavior change modalities to help families make healthy choices and get the care and the access that they need in order to be healthy. So anyway, it's on my mind. And the other thing is, I realize that the opioid settlement funds also have a very obvious and appropriate bend towards harm reduction. And just for the sake of storytelling here again, the BHC and its life under the HRSA grant really empowered public health in its own programming to eventually build out its harm reduction team in a way that I never thought possible. I've only been here 5 years, but the former nurses in this organization who've since retired, who did harm reduction in the past, it would blow their mind what we're able to do now. I mean, just it's wonderful, and we it's also been challenging. It's a really tough profession. It takes a lot from the folks who engage, um, our unhoused neighbors, etc. And they're highly drawn to it and passionate about it. But maybe in the future there is a way to build a harm reduction center, so it's not just sort of a smaller facet of a big, governmental department. And I'm just dreaming here. I'm not saying that needs to happen. And I'm looking at Anya. She and I don't talk about this so much directly, but maybe that is something that becomes a reality. It's a brick and mortar that is its own place with its own sort of fleshed out, fully realized care, navigation, support, events, encouragement of folks to come in and get services. I know that Clown County Public Health is actually utilizing their opioid settlement funds to fund such a thing. So I obviously have a reference in our neighboring county.
An example, Viola?
I'd love to see us collaborate in a way where we are marrying housing, mental health, physical health. There's one thing that I was a part of that I miss dearly. They just sent me a picture. We would go out, it was housing or social work, psych nurses, doctors, MAs that went together to the shelter every Wednesday night. It started at 5:30, and we were there until the last patient was seen, and had nothing to do with trying to convince people to go into treatment. It was treating their needs as they saw fit. And these are individuals who had a tough time maintaining a schedule, who were often had their mental health care canceled because they weren't making their appointments, or they were, they lost their health insurance. And these were all things that we could do as a group together. And we saw this built into many different things. And the successes that I saw there were incredible. Having all of us, like I worked with psych nurses that would find people out in the field, just be like, here, I got your medication, right? And chasing people down and getting them wound care and getting them to the shelter and into housing. I think this is a place where we can start to talk about these integrated strategies for our community for the best success.
Thank you, Viola. Jim?
So we are in the process of piloting a program right now. We get some grant money for a partial hospitalization program, which would help people, especially it's like SUD oriented right now. And really what we're hoping is people can get into the program prior to maybe having to go inpatient, and they can stay in the community. And then definitely as a step down coming out of inpatient to titrate back into the community. Part of the goals I like to see us all working together. There is a housing component I'd like to be able to have, that somebody would in group 5 days a week, 6 hours a day, and then they have a safe place to go at night and help have some case management and monitoring to add that component. And this is where I see how the BHC as partners can say, look, I'm trying to build this. I'm trying to find funding for it. The state right now, the MCOs don't really fund that level of care, but I've been working with them. And if I can show them some numbers and how it would reduce the inpatient cost, it may work out. This partial program not only does SUD treatment, we have psych med management that occurs. Our psychiatric nurse practitioners do some lesson planning in there. We provide lunch. We'll be providing lunch, and I can see us working with, Richard. And I just wanted to let you know that we started this program. We've already got 3 or 4 people enrolled in it, and it's been very quietly started, but it's just based on grant money, and I don't have Medicaid dollars to pay for it, but it'd be nice to have housing at the end of the night that these people can go someplace safe. So that's what we're building right now, and I could see this table saying, "Look, let's find a grant that we can build this out with, and get different partners, and how do we find housing for it, and how do we find other parts to it." I can see Recovery Cafe being part of this. People go to there on one of the days to do more socialization, meeting with people, and just getting them more involved in things. So this is a kind of a desire, because I'd like to eventually expand it to not just being SUD, but really doing mental health also. So people don't have to go into inpatient psychiatric care, and they can stay at home and be in their environment instead of having to be across the state somewhere getting care. So that's my big dream, and we're starting the process. So, and I can hopefully use this table to grow it and develop it.
Thank you, Jim.
Great dream.
Yep.
Sorry, did somebody start to speak? Heather,
Oh,
I see you have a comment. Go ahead.
I just said it was a great dream. Fantastic. It was so cool. I'm glad you shared that. And I just posted a comment about urban rest stops, but
Tell
it's
us a
just
little bit about that. Where,
yeah. So, I mean, I'm seeing lots of evidence-based reporting on urban rest stops, and I think it may have some overlap to what you're talking about here, but not necessarily the same thing. I think maybe a separate tool.
I think what is interesting is at this table, as Apple was saying, we were at one stage at the beginning of that last grant, and now we have built this platform foundation on which we can dream another bigger dream, which we wouldn't have been able to do if we didn't have the first grant. So if we can keep building and reimagining and creatively sort of coming together and say, okay, the landscape has changed here, here, and here. Now what could we do that really fits where we're at now? I think that could really bring good stuff to this community.
I like the idea of urban rest stops. I hadn't heard that language, but Heather and I and some other folks in the housing and substance use world have been talking about how much money we're spending on laundry. Public health spent $4,000 on laundry in January alone, and now we don't have any funds to do any more laundry until June unless we shift things around. And I know other organizations like the Warming Center and Recovery Cafe and maybe OLLICAP are spending money on laundry too, but thinking about how we can strategize and put money like that together and open spaces like urban rest stops or hygiene facilities where folks can access laundry Monday through Friday. Folks can maybe access showers, folks could access computers and cell phones so that they can access all of our other services that sometimes you need a computer or a cell phone to access. So I really like the idea of like a drop-in center that we could all have office hours at, or have people and resources available, and also just be meeting some really basic human needs like getting people a shower, getting folks who live outside a dry sleeping bag and a place to hang out and charge their cell phone.
They're all good ideas. Other thoughts?
This is exactly why this table is here and important to generate this discussion and these ideas. I mean, in this short time, look at all the energy that is starting to develop out of this. So, I mean, it's not about who gets the money and who does what. It's about how do we provide for this community the needs that need to be met and help the people that need those needs met. So,
Yes, Jim. Dr. Caldwell?
Yeah, thanks, team. Sorry I'm late. Always so inspired at these meetings for this very reason that Jim cites, which is everyone has slightly different intel and information about the groups we're all trying to help and coach and guide and provide services for, and yet at this table that nexus can come together. And I just wanted to amplify Urban Rest Stop, donate to the one that's in Seattle. I've been there multiple times with the paramedics. It's great. You go in, you drop off your laundry, you get some like scrubs, you go take a shower while your laundry's happening, and then you come back and you got your clothes. And it doesn't have as much of the Anya edition of access, computer power, etc. But I like that addition. I think that's super cool, where it's a little bit of a lounge where you can hang out and get out of, the 39-degree rain, which is miserable. So it's awesome. This group also, I think, does super well when there's a project, when there's like, we got a need, we got to solve this. How do we put our heads together? Like, there's something that just, I don't know, people like solving problems. Everyone here is a problem solver. And I think, if we have a project to center around and start to brainstorm around, then that I think can bring some fire.
Thanks.
I do have one question to Jim.
I'm sorry,
yes.
Gabby, we couldn't hear you. Go ahead. Gabby?
You're muted, Gabby.
Okay, now can you hear me?
Yes, we can.
Yeah.
Okay, sorry. The HCA put out a document in 2023 about billing for PHP being offered in behavioral health agencies, and that behavioral health agencies should be able to bill in accordance with their agreement under each MCO, and that MCOs were able to bill for that. Is that not actually happening?
That's
Or
what I'm
pay for
working with.
that?
I'm working with the MCOs right now to get that put in their thing, and they're kind of, as I said, the MCOs right now are being very cautious about adding any more billing and programming in the current environment, to tell you the truth. So, but I have set up meetings with them to I set up a meeting a couple of months ago, and I'm trying to get data and documentation to them to show how this would be beneficial. It's not a give me. Just because you can bill for it doesn't mean that the MCOs are going to agree with it. Unfortunately, I wish it was that easy.
Yeah.
Their thoughts, questions? All right. I want to circle back here before we close to the BHAC-BHC Memorandum of Understanding, which the whole point of having this week's meeting at BHAC and this meeting here was to make sure that whatever we want to make sure is substance that goes into that MOU. We've given both tables the chance to contribute and to contribute it from a place of knowing of what the other organization does. Does everybody feel like they've had a chance to say whatever it is they'd like to have in that MOU? Do you understand the two tables now? Is there something more we can do to help that understanding solidify in your own minds before we go forward and try to draft something? Because we'd like whatever we bring forward to people to be something that people feel aligned with as we bring it to them. We don't want to have to go try to backfill our alignment with a document that we put together. Apple, go ahead.
I just wanted to add the nuance that in the eyes of the commissioners who suggested at the end of the workshop at the BOCC in August of 2023, they didn't provide many parameters. I think the sentiment from them, I was in the room, Jim was in the room, so Jim helped me, but the sentiment in the room really was the two tables are important for different reasons. And even though they didn't say it at the time, Lori, I think what they meant was that, you know, what can we do better when we're not in isolation, right? Um, and again, we've seen this arc over the last year and a half of really changes of leadership, changes in amount of funding. So even the BHAC, which is funded through the 0.1% sales tax, oscillated. We had less to give out in this recent biennium via RFP, and that's really hard to stomach. You know, all of these changes that just sort of come and go over the years. We are just, you know, we are trying to figure it out as we go in many ways. And I think that the MOU was really in the spirit at the time of just building trust and making relationship, which I think many of you have just said in multiple ways on this meeting in terms of why we're here and what the value is. So I just want to extend that frame of mind to the notion of an MOU. It is a document, right? It's a legal document. Lori and I have had conversations and we've done some brainstorming. And like she said, we're trying to bring it to the two tables in ways that help you all, the members, and us, the members. I'm a member of this table. I'm actually coordinating the other table right now because I'm short a staff person. But really, really thinking about the bigger value of sharing and knowing and, you know, being at each other's tables and not silencing each other either intentionally or unintentionally. I just think it's just a really good time to strike that balance. And so I've written plenty of MOUs, but this one it's a little bit different. It's taking a lot of creative thought. And so we really appreciate any input that you can give. And we're trying to make the process as contributive and equitable as possible, and not just Lori and me sitting in a room writing something together.
Which comes back to transparency. I think we really do want that, whether it's the money that's spent, the agreements that we're working on, the things that we're thinking about putting together through multi-agencies. I think there is a desire for transparency at this table. And something that we've always worked toward and always are looking for ways to do it better. Dr. Carlbaum.
Yeah, I've not seen the most recent version of the MOU draft, but I'm sure it's amazing if the two of you are working on it. I guess the one thing I would hope to try to capture is kind of the nimble, organic nature of this group. That's maybe a little bit more nimble than a full government agency. And I don't know how to capture that, but maybe some of those words, maybe to capture the sort of volunteerism spirit of this group and how it is collaborative and nimble and responsive to community needs and tries to be responsive in a way that's dynamic and can move a little faster maybe than bigger agencies.
Other folks? Thank you, Dr. Carlbaum. All right. I think I might actually be able to let you go early. So I want to thank everybody for your engagement today. These are complicated conversations, and that we can take the time at a table and really walk through them, I think says a lot about our community. The fact that you guys have made time for this conversation, it means a lot, not just to me, but to all the people that we're trying to serve in as optimized of a way as we can. So we'll be moving on to next steps, looking at creating the MOU in a way that reflects everything that we've learned this week. And I'm always on the lookout for upcoming funding opportunities. I appreciate every one of you when you answer, when I throw out there an opportunity that we might go after, your feedback as we try to brainstorm what we could do with it. I know it's a lot of work from you, and then it's a lot of work to take everybody's input and put it in something that gives you your feedback in some collective form. But I appreciate that engagement and look forward to how we might bring in some next bit of funding. Are there any last words that anybody else has before we let you go? All right. Thank you so much. Everybody have a wonderful afternoon. We'll look forward to seeing you next time. I'll be sending out notes and you'll get the video and all of it. Thank you so much. Bye-bye.
Thank you.